before I give the floor to Piotr. I explain why I'll do that, because he will moderate the final session on the e-health support in the pandemic times, good practices. We will hear the examples from Denmark, from the UK, effects of prescriptions in Poland, remote physiotherapy, and implementation of e-registers, e-records. The speakers will be Hans-Erik Henriksen, CEO of Healthcare Denmark, Rob Wake, Director of Kpis Healthcare Decisions, Elżbieta Piotrkowska-Rutkowska, Chairman of the Pharmaceutical Chamber of Pharmacists, Marian Witkowski, member of the board of this chamber, Ernest Wiśniewski, Deputy President at the Physiotherapist Association, and Piotr Pecko, Sales Director, Transition Technology Science. Comments and discussions will be joined by Janusz Boniecki, Deputy President of the Polish Hospital Federation, and Mr. Andrzej Sokołowski, President of the National Private Hospital Association of Poland. Piotr, over to you. Thank you very much. You just liberated me from reading a very long list of our guests who will tell us how e-health looks from a very mundane, very down-to-earth perspective. All what you had before until now during the e-health forum and what you will hear about the next 2 days are things that are quite abstract, but this session that I'd like to invite you to will concentrate on very practical aspects. We will see how all that looks in real life. This is the last but not the least session at our conference. Please stay with us. It's going to be very hands-on, very interesting. Now, let's give the floor to Hans-Erik Henriksen. Are we ready?
E-health solutions and the COVID-19 crisis from a Danish perspective. My name is Hans-Erik Henriksen, and I'm CEO of Healthcare Denmark. Healthcare Denmark is a public-private partnership. We are owned by the state of Denmark, our Ministry of Health, our Foreign Ministry of Denmark, the Ministry of Business. We are owned by business associations having healthcare companies among their members. We are owned by universities and also by private companies. And it's our mission to kind of have the dialogue with other countries about how we can improve healthcare, address chronic diseases and other serious issues for the healthcare system, and of course also discuss the pandemic, as the session here is also about. The way we carry out our mission normally is that we receive incoming delegation visits to Denmark. We've had the pleasure to have a number of visits from Poland also. We participate and speak at conferences. We join our ministers and the royal family when they visit other countries. And we use the communication and press to spread the messages about where we think we can contribute with ideas and innovation from the Danish side. If you go to our homepage, you can see videos, publication of white papers and cases and information about areas where we think and believe we can contribute to healthcare in other countries from the Danish side. We are proud to have Her Royal Highness, the Crown Princess of Denmark, Mary, as the patron of Healthcare Denmark. And of course, she's happy to lend her name of our mission to foster more dialogue between countries, from our perspective, also to increase the interest for Danish solutions and innovation in healthcare. But the Crown Princess also see our mission as fostering more dialogue, allowing us to get inspiration across countries, learn from each other, and that way be able to improve healthcare across the board internationally. In Denmark, we closed down the country on the 11th of March due to COVID-19. One of the things that happened was that our industry came together with our public authorities, our healthcare authorities in order to respond to the crisis. As you may know, we have a long tradition for close public-private cooperation in Denmark. We have a high degree of trust between our industry and our public authorities, our public healthcare system, and that was definitely a benefit for us in this serious crisis. So one of the things we did at Healthcare Denmark was to take a look at what is the new innovation, what is the things that happen when our industry and our public authorities step up to the sense of urgency and needs created by this crisis. And as you can imagine, this is about testing, because if we can step up on the testing capacity, and if we can create a situation where we know almost within the hour what is the situation of the outbreak, how many Danes are infected by COVID-19, it is an opportunity for us to address it in a better way. And through these activities during the spring, we are actually in a situation that we can control the outbreak much better in Denmark. We are able to control it within regions at the moment and put the efforts into regions and areas of Denmark where we have the worst situation, and then take action. So it's about establishing a national-wide testing capability and reporting of the situation within the hour. Of course, the other area is about hygiene, enabling our hospitals, our nursing homes, for that matter, our airports to be able to increase hygiene status, do cleaning with shorter intervals, but also register and ensure that staff adhere to cleaning procedures. Then it's about capacity and logistics, because if we can have a real-time overview of the status of our hospitals, if we know not only the bed status, but the status of educated staff, equipment to receive COVID-19 patients, then we can balance the capacity and we can avoid getting into a bad situation, being overturned in terms of our capacity. And finally, it's of course about ICU and ventilator capacity. As you can imagine, being one of the most digitized countries within healthcare was a great benefit for Denmark. On the chart, you see kind of the story of Danish digitalization, starting already back in 1994, establishing a health data network. Important points on the trajectory: 2003, when we launched the National eHealth Portal, 2013 and 17, when all Danes got an electronic health record on the internet. So as a Dane, I can log onto the internet, I can access all my clinical information, all my e-prescriptions, lab results, clinical notes. When I come back from a visit to my GP, I have the registration and the clinical electronic record in the palm of my hand. And from 2019, the new digital health strategy, where we move from e-health being about accessing a web portal, secure access to electronic health record, to having it in your pocket with the first step, the Doctor in My Pocket app, and then an ecosystem of apps. So that has been a big advantage for us, and what we have seen is that the digitalization has, of course, supported our efforts on handling the pandemic and the outbreak. With digitalization, with telehealth, with teleconferences, we have been able to reduce contacts and patients moving around. And one of the latest initiatives is this app that also help monitor if we've been close to somebody who was infected. You can also see in this chart how accelerated use of video meetings between patients and general practitioners and hospitals accelerated with the crisis. Little downturn over summer, but then going up again. So this is definitely a big advantage. I talked about earlier testing. Our Ministry of Health is able, as I talked about, to monitor COVID-19 testing by the hour and monitor what is the average response time on test results to our citizens. How many citizens were tested the previous 3 weeks, and what is the immediate situation of the number of COVID-19 patients. And that is possible because we use our digitalization to link together all our testing tents and all our testing capability. And at the same time, we also connect all our hospitals, and that is giving us the total overview I was talking about a moment ago, where we are able to monitor across the board what is the capacity of our hospitals and then balance the capacity. Fortunately, in Denmark, we have not been close to our capacity limit in ICUs due to COVID-19. On the other hand, we are not through this crisis yet, so this is of continuous importance. And then, of course, new technology, hygiene robots that can help us automate and step up on cleaning, hygiene at hospitals, institutions is important. And finally, innovation is also important. What you see on this picture is an automated swab robot developed in only 8 weeks between one of the Danish universities and a private company. You put your forehead here, you open your mouth, then it takes the test, and then it's packaged and sent to the lab in one process. And finally, as I said, our elderly citizens, they are so happy about the digitalization we have in Denmark, the opportunity to use teleconsultations, because obviously our elderly citizens, they are those in risk with COVID-19, and therefore they are really stepping up and increasing their use of the teleconference and telehealth and digitalization possibilities, which can help them live more secure in this COVID-19 crisis. So that was an introduction to how we are using our technology, innovation, cooperation with our companies in Denmark as a means to help our authorities control and manage the crisis. As in many other countries at the moment, we are seeing a worsening outbreak in Denmark. However, we still feel we have things under control, and we hope to stay that way. But nobody knows how we will stand before we are at the end of the crisis and we have a vaccine available. Thank you very much for your attention.
Dziękujemy bardzo.
Thank you very much. This was a quick overview of how Denmark handles the pandemic. Denmark looks rather good in the overall European ranking, with only 63 confirmed infections, which is basically what we registered in Poland over 3 days only. Now let's have a look at that from the British perspective. Rob Wake from Capital Healthcare Decisions will speak. Unfortunately, the UK is one of the countries that is off worse than other countries. 767,000 infections, so Britain's lagging third from the end of the whole pass or motorcade, so to speak. So how digitalization can improve the situation?
Thank you. Thank you for the introduction. Good afternoon, ladies and gentlemen. Let me give a little introduction, if that's okay. Okay. A little bit about Capita software and Capita PLC as a starting point, and this certainly isn't intended to be a sales pitch. Capita PLC are a FTSE 250 organisation. We turn over 3.8 billion pounds sterling. We employ 63,000 people around the world across 14 major industry verticals, of which health is one. We would describe ourselves as a consulting, a digital services, and a software business. And it's the health business that really we have focused our energy on. Over the 10 minutes, I'm going to give you a feel for a bit about our position from an international stage, rather than talk specifically about the UK. I manage business development internationally, so outside the UK market, but I will make some reference to that. And I really wanted to explain some of the impacts that the pandemic has had in terms of technological evolution and how it's done that, and how important I think health will be moving forward as we come out of the back of COVID. I think one of the things that's interesting, and I see this whichever customs I speak to in whichever part of the world, there is a significant change in how healthcare is supporting TRIS population-wide. And the emphasis is very much on being able to support individuals, educating them, and providing that interoperability that enables the patient to be self-supported and provide individual care for themselves. As a consequence of that, there's also digital engagement and the ability to provide clinical support at an individual level. I'm sorry, I can hear myself in my headset. Is it possible that the broadcaster could just switch that off? I'll continue. So hopefully we're looking here at providing the ability of a more personalization of care. So the actual care plan for an individual, particularly somebody who have a chronic disease, can be managed on an individual level, and the clinical outcome is more successful in terms of longevity of life and the overall quality of life that individual has. And that moves forward to more detailing in terms of end of care and the case management as somebody moves into that particular end of life environment. In terms of one of the key statements here, medicine is becoming more tailored and it's more to the individual. And we're moving from one size fits all to a personalized care offered to higher cure rates and fewer side effects. And I think as the COVID situation has developed, we've seen more focused activity in this particular area in terms of looking to provide the care and the requirements that's needed across the age bands. So how does this impact in terms of digital transformation? Well, one thing is certain, as we speak to our customers, transformation in health is not easy. In fact, it's very difficult. And there are several factors there that cause us to have increasing emphasis in this particular area in terms of technology. And ultimately, we're looking to drive out the inefficiencies. So what does success look like? Well, historically, as a patient, we would engage with a doctor and the various organizational bodies that we deal with. But ultimately, there are three facets to improvement in care. One is being able to link together all the associated clinical organizations under one umbrella and be able to provide the technology that interfaces those. And I think Hans speaking in terms of what Denmark has achieved is a great credit to that particular country and some of the activity that's taken place there. And the Nordics are regarded as being at the forefront of this development. And the third point is about putting the patient at the center of the continuum and giving the patient the advice and information and control that the patient needs to make an informed decision about their care pathway. And we know that this is driven by some key health drivers around the world. I'm not going to touch on them all here personally, but they're common across all the countries that we actually see. And as organizations, technical organizations, we need to look to respond accordingly. So we're concluding that the most important primary care providers are the patients themselves. And it's important they are involved in the decision-making process and are supported by physicians and clinicians to aid their clinical care. So what does that look like in terms of COVID? For us as a business, we had to respond quickly to the demands of our customers and the organizations that we're working with, and to provide our clinical algorithms in a manner that were fully incorporative of the need to provide that investigative information around COVID itself. From our perspective, we have to be able to manage the clinical risk, and we have to ensure that the evidence around the decisions that we're making are correct for our customers across the world. You can see here that our initial investigation started on the 23rd of the 1st, and by the 2nd of the 4th, the COVID algorithms were fully incorporated into our solution. What does that look like? We happen to be a Microsoft Azure platform, but the reality is it can be in any major platform around the world or any major clinical health system. For us, it's about the ability to bring together the appropriate solutions and be able to manage that interaction on a day-to-day basis, and whether that be via over the phone with a call handler, whether it be via a customer patient portal, or whether it be by video conferencing, but the facility to manage that end-to-end patient environment, fully integrated across both primary and secondary care. So graphically would look like this. Doesn't really matter what the interface is, whether it be web, mobile, a call handler within a call center, or video application, but ultimately it has the ability to interface with the patient, the clinician, and the healthcare professional, and link back to the patient record, as really Hans has explained in terms of what's been achieved in Denmark at this moment in time. Ultimately, what comes out from our perspective are three key instructions. What should the patient do next? What advice should we give the patient in the meantime to deal with their condition? What do you do if the symptoms worsen? And how do they manage that in terms of patient information and self-care advice moving forward? How does it work in practice? I've hopefully got a little short animation here, which will conclude this presentation. So this is live on our website, if anybody wants to look at it. I'm not sure whether you can hear that or not. I'm going to work on the premise that you can't hear that. So I'm going to look to move back in to the video itself. Technically, could we bring back up the main PowerPoint? Thank you. So just to complete this, ultimately what we're looking to do is provide a complete solution that's fully integrated and works across all platforms in terms of accessibility. The one thing that is certain is what COVID has done has sped up that process and has driven both digital transformation and health tech. And I think we'll see some significant pace of change across some of the major countries around the world as we move forward. Thank you for your time.
Well, thank you very much, Rob, for your exciting presentations. I need to reassure you that we couldn't hear the sound, but there were inscriptions on the video which were very clear, and I think we've all comprehended what's the point. So thank you very much for your presentation, which has shed some global light on those issues. And did not reduce them to the context of COVID. But let's proceed with presentation of our Polish guests. We have Elżbieta Piotrkowska-Rutkowska and Marian Witkowski of the Polish Chamber of Pharmacists, who are going to discuss implementations recommended by the Ministry of Health. I think you are going to talk about e-prescription. Can you hear me? Because I can hear myself. Ladies and gentlemen, at the beginning I would like to apologize on behalf of Elżbieta Rutkowska, but because we are currently discussing the Act on Pharmacists, it's a milestone act for the pharmacist community, and the head of our chamber has other obligations. So in her replacement, I will present key elements identified by our community recently. Well, ladies and gentlemen, what is important, I need to mention that in the past 2 years in Poland, we witnessed introduction of a number of elements relevant to e-health. Well, some call this period evolution, but I believe that it's fair to say that in terms of healthcare developments witnessed from 2019 until 2020, it was actually a revolution. So, like I've said, in a very short stance of time, we saw introduction of a number of electronic tools whose implementation was scheduled, and on the other, the pandemic forced or triggered implementation and development of some tools. So very briefly, I would like to give the overview of these tools. I think the key one, especially for the pharmacist community and for patients, so the key element of e-health is electronic prescription. And by the way, in the wake of pandemic, electronic prescription is the winner, is the most popular, is the best solution of all. And what you can see on this slide, Poland is one of few countries in Europe which introduced electronic prescription across its entire population, and we have a population of 38 million people. Most European countries have electronic prescriptions, but they have been introduced to a limited extent. Electronic prescriptions, in the system itself, is very patient-friendly. It is also friendly for other users of the systems, for the prescriber and for pharmacists. Of course, these are early stages, and there are many childhood diseases, so it wasn't different in case of e-prescription, but time and experience we are gaining has enabled us to refine this tool. And today, shortages of the system are few and far between, and I think very soon, together with e-Zdrowie Center, they will be eliminated for once and all. So, like I've said, the system itself is very friendly. Regardless of age, patients are able to cope and embrace the system. Access to electronic prescription is easy. You can either print it for your information, or you just produce the PIN number and provide your personal number at the pharmacy. There is also an app designed by the Ministry of Health, M-Obywatel, that's the name of the app. On the right, you can see an icon which provides the patient with access to e-prescription. So you can easily buy medicine in the pharmacy. So all patients are coping very well with e-prescriptions, even 70-something-year-olds, to provide the PIN number and personal number. It's easy. They can also print it out. I also wanted to show you those stats. As you can see, marked in blue are paper prescriptions, and marked in red are e-prescriptions. So from January 2019, when e-prescription was introduced in Poland as mandatorily, and from January 2020, it was introduced as a mandatory tool for prescribers. You can't prescribe it differently nowadays. And as you can see, the ratio of prescriptions, which goes into tens of millions a month. So, it's fair to say that it's a tried and tested solution. Back in 2019, we had 19 million e-prescriptions. Right now, we have more than 50 million e-prescriptions a month. So it's a natural pace of transition from paper prescription to e-prescription. An additional facilitation for the patient, which takes the burden off from the healthcare system in Poland, was a change implemented in April 2020 that introduced electronic pharmaceutical prescription. This legislative amendment gave much wider competencies for the pharmacist who is authorized to produce a prescription. It was very well received by the community, and like I've said before, it takes the burden off the healthcare system. Because, for example, if the patient cannot see his or her physician, the pharmacist is authorized to produce a prescription and hand over the drug as a follow-up of a previously selected therapy. And very briefly, another element of e-health, the integrated system for monitoring trade in medicinal products. Well, it's a tracking or a monitoring tool that monitors the medicinal products ever since the batch is released until it reaches the consumer. The main pharmaceutical inspector is the supervising body. We are still waiting for the system to produce fully measurable benefits, not only for the legislator, but also for its business owner. And for the patient and the pharmacist, what we look forward to is using data transferred to the integrated system for monitoring trade in medicinal products. The patient will know where a given drug is available. Because at the time being, you can use a commercial platform such as Ktomalek or where to buy your medicine, but the effectiveness of those platforms is doubtable. So data are very old. Very often patients are misled. They are visiting pointlessly pharmacies, which is why the integrated system for monitoring medicinal products and reports will be sent once a day from all entities across the medicinal product chains will be available for the patient.
Especially in the period of the shortage of medicines, both in Europe and globally. By the way, information on that ZS MOPL system, about who is monitoring the data, who is capable of analyzing or authorized to analyze it. Here are the scopes of data. For us as the reporting entities, when we report to that system, even though the system has been in operation for 2 years now, this reporting process is far from being automated. So most of the reporting obligations are made manually in an electronic system, but still it's a manual work. Another system that is not a child of e-health, e-Zdrowie, but what was created by the public payer is the system that actually monitors the auxiliary product supply. It works by the same token as the e-prescription. The patient must not go to the public insurance, because based on recommendation by a doctor, the insurance would accept or reject that recommendation, and the patient would come to the pharmacy, give a unique access code, and that's it. It's a very helpful tool, which is very noteworthy, and which appeared in early 2020 and gave us enormous boost during the difficult times of COVID-19. Another tool that we should also focus on, which is not fully mature, is the input tool. It facilitates for patients availability of the therapies that have not been licensed for trade in Poland. Let me give you an example. If a doctor wants to treat a patient with a medicine, with a drug that's not been licensed in Poland, issues a certain order, and the patient would go to the national coordinator, consultant with that slip of paper, and then the patient would go to the Ministry of Health to receive or not to receive the endorsement of the therapy, and if possible also confirmation of the refund. Now the process is going to take place electronically. The patient receives the info that the application was endorsed and can be actually committed. We've been waiting for this solution for years. It would be good, though, if the system encompasses all the businesses or all the organizations that are involved in the whole process. It seems that the pharmacies still receive paperwork from the system rather than electronic dispatch. And finally, let me speak about yet another child or product that is a portal for supplies, for ordering IPP measures and products. It revolutionized the flow of IPPs for the medical personnel in hospitals and pharmacies. That platform has proven its worth, and now the pharmacies, including those in hospitals, can order disinfectants, face masks, gloves in that system, and they receive those products from the reserve stockpiles. And the final tool that's definitely worth speaking about is the internet-based patient account. This is one of the most significant tools because it collects the entire knowledge about the state of a patient in one place. We still wait for the electronic medical records, which are going to be connected with this platform. The platform is a kind of open book for the patient, as it contains all the details of her health status, treatment history, prescriptions, referrals, and so on. All in one place. Why I'm emphasizing it? This is because before the so-called ZIP was introduced, the patient was denied that information. That set of information was only restricted for use by medical facilities, which stored data and had knowledge around it or about it. The patient's internet-based account, although it's owned by the patient, it will in future serve to monitor the therapy of a patient in the most excruciating details, and also to prepare the therapy or the healthcare care of the patient. Thank you very much, and apologies for going beyond my allocated time. Thank you for this very in-depth review of the digital instruments in the health system. I think our international participants deserve a solution. These tools were planned long before the pandemic broke out. It was just a coincidence that they were implemented this year. For example, e-prescription was launched before well before pandemics. Other systems that were discussed during this presentation didn't have much in common with the pandemic, but they occurred in the right place at the right time. Thank you very much. Now I give the floor to Ernest Wiśniewski of the National Chamber of Physiotherapy. But please mind the clock. Thank you. Good evening, ladies and gentlemen. I hope I'll be swift and efficient in describing the best practices that we introduce in the realm of physiotherapy. I'd like to refer to the title of our section, all the e-health solutions that we have planned and executed. Combined with the long-term plan of implementing digital solutions in the physiotherapy area. So the pandemics helped us to do that, but our efforts were not motivated by the pandemic itself. I have no control over my slides. Could you do that for me, please? Now, the first thing that I want to say is that I want to follow up on my presentation at the previous year's e-health conference. I spoke at that time about 3 integrated systems, and the third one was already in the production, we're just about to be put in the production phase. The first one is the portal for internal communication between the chamber and the physiotherapist, with individual accounts, training opportunities, etc. The second system is for patients. It's called Find Your Physiotherapist. Patients can look for physiotherapists all across Poland, and the system is integrated with the National Physiotherapists Register. So the referrals that show up in the system are absolutely authorized. Also, the physiotherapist can place visit cards, business cards showing their specializations. For many years, we have specialized training because you offer different kind of physiotherapy to a person with, let's say, brain tumor or hemorrhage, as opposed to the rehabilitation of a newborn baby. So this search engine allows you to find the right therapist. And the third system is called Finisio, and it serves to electronically process documentation. All the 3 systems are integrated in one portal. There's also a version for smartphones, for mobile devices. So the Finisio system responds to the need by the market and to the compatibility issue with legal regulations. It also meets all the requirements that the physiotherapists need to fulfill. There is a version for individual practices with more than 40% and 30,000 people using the application. And soon we're going to launch, in a couple of days, we're going to launch the version for businesses, since every business or organization rather, employs from several to a few dozen physiotherapists. And we have many registrations, so I believe that several thousands of physiotherapists will have been using this application by the end of the year. So what are the fundamentals of that application? This is the first application or IT system that helps you to identify the third health performance indicator, that is functioning of a patient. No other systems in Poland are able to monitor it. We have put in the system 70 activity tests that monitor what is important for rehabilitation. For example, if a COVID patient is able to get up from the bed, walk down or up the stairs and just operate independently. So based on those indicators, you can measure up a patient and also the efficiency of the therapies. We have also global KPIs. WHO-DAS is the product of World Health Organization that measures the entire population, both individuals and the whole population of a given country. As far as solutions for the patients are concerned, the documentation processing system, possibility to set visits or set dates for the visits, alerts about visits, cancelling visits, it's all in the package. We don't need to sign up any further or additional agreements with the operators, and you can predefine all those parameters. The next chapter are online visits, online checkups. We have connected Skype browsers for that or other things that allow you to also conduct tele-rehabilitation. Finesio gives you also the possibility to communicate directly and send recommendations to the patients in the form of videos, films, pictures, and so on. So there is a fully integrated system encompassing preparing a date, preparing a visit, and conducting tele-rehabilitation, all compliant with the pertaining legal requirements. Sorry for that. The last thing I want to mention is that the system is in the phase of being integrated with the internet-based patient account. And doing so, we are limited just by our capabilities, but the engineering work has started, and soon we are going to see full integration taking place. And we are going to conduct integration with the National Healthcare Fund, so that the outcomes of the rehabilitation can be also reported to the public fundraiser payer. Thank you very much for this. I'm not sure if that's my impression only, but since I started dealing with medicine, which is more than 25 years, physiotherapy, that I believe that the physiotherapists were sort of put always on the back burner. Now you integrate and you become part and parcel of the internet-based patient account. Superb news. Before we move on to the representatives of the hospitals, please hear another presentation. Mr. Piotr Kościelniak, who represents transition technology science, will speak. We can see each other, but we can't hear each other. When we spoke with Piotr last time about e-registers, the company was named Transition Technologies. Now we have this addition of science. Why this change in the name? Sorry, I didn't switch on my mic. Thank you very much for this. Indeed, we have made a small addition which occurred today. In the past, we were but a department within Transition Technologies, but as of today, we started a new journey and will continue it formally as of the 1st January. The name is not a coincidence, because our entire operation will focus on supporting scientific and research activities across the healthcare sector. this is because we are capable of looking further out into the future. I cannot control presentation either, so please switch the presentation for me. Super, thank you. As I said before, the change was about our department being spun off. We are composed of biochemists, IT engineers, and many other specialties, and I think data is our universe. We specialize in big data and small data analyses, because sometimes what you need is to cast a look at the individual patient rather than the whole organization.
And today's presentation focuses on two cases, two examples. Well, the first one is a solution which has been put in place more than a year ago, and the second one is a concept that I will dwell on later. Well, medical registers, I think this is one of the most vital and fastest developing areas. So also because I believe it myself, those central hospital systems should be in the center of attention when we are talking about patient records. But very often there is inertia of large providers who are unable to swiftly react to emerging needs in terms of collating records. And one of the issues encountered by healthcare is the quality of collated information. So we need to make sure that quality is continuously improved, because high quality records stand for more flexibility, higher quality of further analysis. And it doesn't matter who is analyzing them, machines or man. So this solution came as a response to a need identified during pilot implementation of nationwide oncology program. So 3 provinces are taking part in the program, and all hospitals located there are collating records, very detailed records, very accurate details of cancer patients. It's no easy. So it came as a response to current needs. It enables keeping very detailed records of onco patients. The system benefits 30 hospitals in 5 provinces in Poland. And as a result, all medical records kept in the store are uniform. And because it's uniform and it's collated in line with the same procedures in different clinics, you can view medical status of patients covered by pilot implementation. It facilitates coordination, and because you know how complete records are when the patient proceeds to the next level of diagnostics or therapy. Well, the tool we have implemented facilitate decision-making and also facilitate ongoing verification if records are complete. If there is anything that is missing, we are trying to supplement it as we go. So the system is separate for each province, but patients that migrate between hospitals, because that's the concept of this solution. Patients are moving from one clinic to another one, and all clinics have access to patient records. So at the end of the day, doctors in different hospitals have complete medical records of a given patient in one place. You also have timeline marking all major events in the medical history of the patients. You also have information about scheduled surgeries. And you can look up very detailed information on test results, on oncological history. So everything that you need is there. And all descriptions, all records is created in such way to make sure that information is facilitates easy interpretation. For example, if you have test results, you have just results available. We want to support decision-making process. We want to support drawing conclusions because medical records can be lengthy. And because pilot has been joined by several dozen clinics, you have geographically limited interoperability between them. Well, of course, the system is easy enough, and you can create additional questionnaires for patients to obtain additional information, which were not defined when the system was set up. And it also allows users to collate the so-called soft records, which may be helpful to assess the quality of treatment from the patient's perspective. It's very important. The quality of healthcare, the quality of support provided to the patient is vital. So coordinators are doing massive work, and they are very satisfied. They are very happy with the software. So as a result, because we have high-quality records, we are able to design different analytical models. I can't show you all of them, but for example, automated modeling of treatment paths for different types of cancer. Paths may be compared by different clinics, and what we can see right now is another functionality. You can compare measures. We have 40 qualitative and quantitative measures described by the Minister of Health. And because we have data warehouse, which will be put in place shortly, we have made several thousands of computations using available medical records. So every month we are computing several dozen measures, and what we can see right now on the slide, it's the same tool but with older layout that shows how measures were evolving over time. So right now you're able to collate so these are measures which are collated in one stop. They are split by provinces covered by the pilot, and right now we are developing the tool to enable comparisons of the value of the quality of different measures over time by individual hospitals, for example, from a very different part of Poland, or by provinces, in terms by different cancer types or by different measures. Well, this solution has basically been put in place. It is available online. It's not fully used. It's the register of COVID-19 beds and ventilators. So it's a response to current needs. The concept was born at the Polish Federation of Hospitals, together with Professor Fedorowski, who told us what the Federation expected from us. We were asked to design a tool which, by design, was to support coordination and distribution of patients to hospitals that have the biggest number of resources, or the biggest resources. And resources were defined as available patient beds and available respirators. So the first thing you can see is the map of Poland with all hospitals in our country marked on it. As you can see, they are gray because they have not been activated. But if the system came live, those pins would change color. There are several colors depending on availability of COVID and beds and ventilators. So we draft the first report. We defined the number of beds and ventilators available and the number of beds and ventilators occupied. So it's changing every second, because in every hospital there is a dedicated person who feeds data into the system. So in real time, we have a preview of the number of beds available at a given hospital. And Professor Fedorowski wanted ambulance dispatchers to know in real time where to send a given patient to provide adequate help. And administration-wise, we have statistics. We know what's the number of ventilators and beds by provinces, and we also have the list and the map of hospitals. Okay, so that's everything I wanted to tell you about this register. The tool is up and running. Hopefully, in the future, we'll start feeding information into it. And because we are talking about health records all day long, and like I've said, one of the key elements of our business activities are data warehouses. In fact, we are now specializing in standardizing health records, and as a result, in central warehouses, we are able to collate patient records from dozens of different sources, what later facilitates their diagnosis, analysis, comparisons. And it's cool, and it's a very exciting topic for further discussion. So that's everything from me. Thank you for your attention. Well, thank you very much for very detailed presentation, and thank you very much for touching on COVID-19. Because as we know, the OnCo pilot, is happening in the shadow of pandemic. So thank you very much for keeping the time, and I keep my fingers crossed for the new project. And right now it's time for discussion. Janusz Boniecki, the Vice President of the Polish Federation of Hospitals, and Andrzej Sokołowski, the President of National Association of Private Hospitals. I would like to ask you to share your insights. What do you think about those solutions? What's the impact of these solutions on effectiveness of our campaign against COVID? Janusz Boniecki. Good evening. Can you hear me? Thank you very much. Well, it's late, so I'll try to recap shortly all statements. I was listening to your conference, and I wanted to share the following insights. Mr. Brejewski of ASECO stated that the IT system in times of crisis, so we are talking about COVID again, should enable central management. Are we succeeding at it? I have doubts, because we also had the current Minister of Health, who took part in at least several conferences, and he was in favor of command center that we know from Houston, US. And right now, I would like to go back to Mr. Drojewski. If we had such nationwide command center, it would be much easier. I thought it would be good to have such command center in a province, but right now I'm managing a hospital that straddles three borders of three provinces, so I opt for the nationwide solution. We have had from Professor Fedorowski COVID beds with ventilators and transport of patients. We are really struggling with it. Information flow is not smooth. We hear of ambulances, and there is a shortage of ambulances, and they are visiting hospitals, several hospitals in row, because all beds are occupied. I know from informal sources that we are very often using our private phones. We are calling people, getting back information which are out of date. Last week, for example, I know that someone spent 40 minutes trying to come to an arrangement. So, yes, we can book beds like airlines book tickets, but, it doesn't really work. For example, when I'm buying train tickets, if I'm 5 minutes late, it's taken by someone else. So do I have such information in real time that someone is waiting? The Polish network of hospitals makes you think that it's easily doable. But if you have a patient occupying a bed with a ventilator, you update information, but sometimes the ventilator is taken by a patient. And all across Poland, we can see that this specific bed is empty. I don't want to quote numbers. And the same goes for transport. Ambulances have connectivity, but very often they are traveling all across Poland looking for an empty bed. Very often they have to drive 100 kilometers to fetch the patient and take him or her 100 kilometers away to a hospital with an empty bed. So, where I see hope, looking back on has been said today, we have manual reporting. That's what we've heard from the Polish Chamber of Pharmacists. So if you're entering data manually, you can write whatever you please. And the system, in my opinion, every hospital should be committed, mandatorily committed, to automate data feed with no manual data entering, like in global networks. For example, you can book a room in any hotel worldwide. You can do it because there is an app. But here we are struggling because you have to make a number of phone calls and manual reporting. It's not the way forward because everyone will be probably trying to fiddle with it. This is what we see with queues, lines of ambulances. The Polish Chamber of Physiotherapists, I don't want patients to look for physiotherapists on their own. I see hope in AI. Artificial intelligence should be familiar with my needs and suggest physiotherapists. I don't have to be an expert. I can know nothing about it. How can I choose the right physiotherapist? Okay, so we've had many bitter words. No, not bitter. I know there is room for improvement. A question to Mr. Sokołowski, your perspective. Do you share this critical view of current situation? Yes, I do. Can you hear me? Yes, from the perspective of private hospitals, I do. I've been listening to developers. From the first session, you are presenting different platforms, different solutions. It looks like blowing your own trumpet. We have better solutions, but I'm worried that they are not connected to anything. They are not connected into a single central system. I can't imagine my much younger medical colleague who, faced by much more complex medical procedures, will have to use all those systems. So, probably you will all reach a conclusion one day to ensure connectivity of those systems, but that's in fact the role of the Ministry of Health, not yours. What is the ministry doing? Digitization, which is supposed to be so advanced. Today, the ministry is issuing written regulations. They want to include private hospitals into the public healthcare systems. They have no idea what we have inside. We have a hospital which has been designated as a future COVID-19 hospital. We have no oxygen, we have no experts, and the day later, we had to apply to have the decision to have the application of the governor revoked. So it means that on the central level, there is no information about capabilities of private hospitals, about their fittings, equipments, and capabilities. And we know it because for a long time, we have been publishing the catalogue of private hospitals because no hospital is committed today to publish its specific information online, for example, the number of beds, the number of ventilators, etc. How it's done today, there is mess.
A my chętnie jako sektor prywatny.
All right, may I interject a question to Mr. Petsko and to Rob Wake? We heard that we are actually making ourselves important technologically, but in practice, this looks much less appealing. Well, I do agree we have interference. I believe that we are not moving in the right direction. We attempt that IT systems in the hospital be prepared for a multi-channel communication with external facilities to build a standardized system. Because smaller companies may as well prepare a very capable solution at a faster pace than the big IT juggernauts can do that. So the point is to enable two-way communication, and the user would see just one tool. Then the underlying system would be a different story. And our big companies do not support that. So we want to enable those facilities that have problems in communicating to create a standardized environment to exchange patient data. This direction should be towards opening access. But we've heard for many years that it's not simple. In one companies, there was a sort of glimmer of hope. But I believe that the only sensible direction is an organization. I think that the central medical organization or something that will enforce that. To Rob Wake, what do you think about the confrontation between an abstract idea and hard reality?
I think it's an interesting observation that's been made today, and I think the one thing that COVID has done is create very much that disruptor within the health community at every level. And from a health perspective and the health ecosystem, and to be honest, this doesn't really matter in terms of which country I'm talking about here. So I'm sure, I'm aware that this applies to Poland. and the majority of Europe as a whole. But the ability to be more agile and have the ability to integrate the end-to-end health capability within country and have the technology to bring that together is the fundamental challenge today. I think technology has come a hell of a long way in the last 2 to 3 years. I think the time is right for the ability to provide that integration. Do I think that that needs to be driven at a central government level? Yes, I do. I think because if you don't get that right at the top and allow that to facilitate down across organizations, I think that challenge becomes very difficult. You look at the markets around the world where health is deemed to be at its highest level, and the Nordic countries are out there, but ultimately Israel and Singapore are the two countries that get cited as having the best health economies around the world, and they are well worth a look in terms of how they've embraced technology.
Bardzo dziękuję. Widziałem, że
Thank you very much. I think Mr. Sokolowski wanted to raise hand. 2 sentences, please, to wrap things up. I just want to add something, because we see what the situation is like. Everyone is working on their own projects. In the private hospital sector, we found we select a company who is now an integrator, and through which we look for solutions on the market that fit our needs. And we create this environment. Thanks to our advances in the IT integration, we have started printing hospital statistics, because in fact nobody knows what is going on in the hospitals. So we started publishing statistics on the hospitals on our website, but it's still only us that we benefit from that publication. Nobody else has ever asked about those data. The first application of the data was by the private Enelmed company during the International Economic Forum, when they showcased e-prescription. So the private sector was always prepared to launch the latest and the brightest solutions. Earlier this year, in the spring, we have launched a competition for the best practices in the pandemic times. We received a lot of suggestions, including a statement: less contacts with the patient augments the relationship. So we distributed smart bands that are capable of measuring blood pressure and many other parameters, so the medical personnel do not need to touch the patients all the time to check up on them. But this is a kind of a guerrilla atmosphere fight. We need to receive from the ministry indications about the directions into which the systems would march, so that we don't need to look for patients' data on various platforms. Because right now I see that I should write on a piece of paper, on a slip of paper, the names of various platforms. On one I look for medication, on the other for a physiotherapist, and the third system I can locate that medicine. I hope that we can find all that data in one location, maybe on the interactive patient's logbook or records rather. But you won't find that information on a patient account, I believe. So I believe this is just theory. A question, finally, If the patient does not want, oops. All right, sorry. Next time. I swear I did not cause this interruption. Ladies and gentlemen, we are looking at the best proof of a e-conference not being able to substitute for the real thing. We would have normally continued that discussion over coffee or a cookie, but I need to be firm now and conclude the discussion. I thank you very much for being so active, for the contributions, for exchange of views. And we conclude the first day of the eHealth Forum 2020.